Hello, everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the Pharmacist. Today, I'm going to be spending some time with you talking about a very interesting topic called bacterial vaginosis. This is a channel where we educate ourselves on common health problems. So if you're new to this channel, please don't hesitate to hit on that subscribe button and also on the notification bell so you don't miss any video that I upload. Bacterial vaginosis is a common vaginal infection. A lot of different types of bacteria exist naturally in the vagina, just like your digestive system. Bacterial vaginosis happens when some of the vaginal bacteria grow more quickly than others. Too much of one type of bacteria leads to an imbalance in the acidity of the vagina. Bacterial vaginosis is the most common cause of abnormal vaginal discharge that occurs in sexually active women aged between 15 years and 44 years. It is not a sexually transmitted infection. And as we go along, I'm going to be answering some questions that most people ask about bacterial vaginosis. Our first question is, what are the factors that increase the risk of developing bacterial vaginosis? And these include being sexually active. Being sexually active or having recurring sexually transmitted infections increases the risk of developing bacterial vaginosis. People with a new sex partner, those with multiple sex partners, and those with female sex partners are at risk. The use of douches, deodorant, and vaginal washes, menstruation, and presence of semen in the vagina, copper intrauterine devices, smoking, pregnancy are all things that can put you at risk of developing bacterial vaginosis. There are also some factors that can reduce the risk of developing bacterial vaginosis, and these include the use of hormonal contraception, consistent condom use, and when you have a circumcised partner. Is bacterial vaginosis a sexually transmitted disease? Bacterial vaginosis is not sexually transmitted, but it is linked with sexual activity. Researchers think that sex may change the bacterial environment in your vagina. This makes bacterial overgrowth more likely. Is it contagious? Bacterial vaginosis doesn't spread from person to person, but sexual activity can increase your risk of getting the infection. What are the symptoms of bacterial vaginosis? Approximately 50% of women with bacterial vaginosis will not show any symptoms. But when symptoms are present, bacterial vaginosis, or BV, is characterized by a fishy-smelling off-white or gray vaginal discharge. The smell is very strong, particularly after sex. It does not usually cause soreness, itching, or irritation. And bacterial vaginosis goes away without treatment in some people. In others, antibiotics successfully treat this infection. One other common question that people ask is, how would you know the difference between bacterial vaginosis and a yeast infection? Both bacterial vaginosis and yeast infections are vaginal infections that increase discharge. And here is how you can tell the difference. So first of all, let's look at the discharge. The main sign of bacterial vaginosis is discharge with a fishy smell. Discharge from yeast infections does not usually have a strong smell, but may look like cottage cheese. Secondly, vaginal irritation. Typically, bacterial vaginosis doesn't cause vaginal irritation or itchiness. Yeast infections do. Now, over-the-counter treatment. You can treat yeast infections with over-the-counter medications, but with bacterial vaginosis, you would have to see your doctor for some antibiotics. Now, let's go on to our next question. Can bacterial vaginosis be prevented? Most episodes of bacterial vaginosis occur for no apparent reason and they cannot be prevented. The following are thought to help prevent some episodes of bacterial vaginosis. The logic behind these steps is to try not to upset the normal balance of bacteria in the vagina. These preventive measures include avoid douching, that is, pushing water into your vagina to clean it. Your vagina doesn't require cleansing other than normal bathing. Frequent douching disrupts the vaginal balance and may increase your risk of vaginal infection. Douching won't clear up a vaginal infection. Also, do not add bath oils, antiseptics, scented soaps, perfumed bubble baths, shampoos to your bath water. Using a condom and or a water-based lubricant during intercourse may help protect you. Avoid using sex toys inside the vagina and avoid thongs and tight nylon tights. Have showers rather than baths, and lighter periods seem to make bacterial vaginosis less likely to return. So if you have heavy periods and we're considering seeking treatment, this might be another reason to do so. Do not use strong detergents to wash your underwear, and do not wash around your vagina and vulva too often. Once a day is usually enough, using gentle soaps and water. Don't use perfumed intimate hygiene products. As much as possible, avoid a sexually transmitted infection by using condoms. Limit your number of sex partners or abstain from intercourse if possible to minimize your risk of sexually transmitted infections. So what are the treatments for bacterial vaginosis? There are a variety of possible treatments, and non-pregnant women with no symptoms do not usually require treatment. For women with symptoms, oral metronidazole is the treatment of choice. Metronidazole is an antibiotic that helps clear bacterial vaginosis in most cases. It is important to read the leaflet that comes with these tablets for the full list of possible side effects and cautions. The main points to note about metronidazole include metronidazole is usually given over a period of 5 to 7 days. Sometimes a single dose is given as an alternative, although this may be less effective and may cause more side effects. The single dose is usually not recommended if you are pregnant. It is important to finish the course you have been prescribed and not miss any tablets. Some people feel sick or maybe sick, that is vomit, when they take metronidazole, and this is less likely to occur if you take the tablets straight after food. One other common side effect is metallic taste in the mouth. Do not drink alcohol while taking metronidazole or for 48 hours after stopping treatment. There's an interaction that occurs between alcohol and metronidazole, and this can cause severe sickness and vomiting, and may also cause flushing and an increased pulse rate. Also, if you're breastfeeding, then note that metronidazole can get into breast milk in small amounts, but this will not harm your baby, although it can make the milk taste different. The manufacturer recommends that if you're breastfeeding, you should take the 5 to 7 day lower dose course of metronidazole rather than the single large dose. Alternative antibiotic treatments are available, and these include tinidazole tablets and clindamycin tablets. Tinidazole is offered if you are intolerant of metronidazole, and it has the same interaction with alcohol that is seen with metronidazole, meaning that alcohol should not be consumed whilst you're taking it or for 48 hours afterwards. Tinidazole is not recommended in pregnancy. Also available is metronidazole vaginal gel or clindamycin vaginal cream. These are placed inside the vagina and can be used if you prefer this type of treatment or if you experience unpleasant side effects with metronidazole tablets. These treatments are believed to be almost as effective as antibiotic by mouth. Avoid alcohol while using metronidazole gel and for at least 48 hours after stopping treatment, although the tendency of the gel to make you feel sick are not as noticeable as for the tablet. Just a word of caution, vaginal creams and gels can weaken latex condoms and diaphragms. So it is important that during treatment and for 5 days after treatment with clindamycin vaginal cream or metronidazole vaginal gel, you do not rely on condoms or diaphragms to protect against pregnancy and sexually transmitted infections. Our next question, is yogurt an effective treatment for bacterial vaginosis? Some women with bacterial vaginosis say that things settle more quickly and symptoms are eased by applying a thin coat of plain live yogurt to the outside of the vagina daily, and by applying a small amount of plain live yogurt on a tampon for internal use before bed. The evidence that live yogurt is helpful in treating or preventing bacterial vaginosis is mixed, with some trials saying that it is helpful and some saying that it is not helpful. Overall, specialists feel that there is not enough evidence in its favor to suggest it over other treatments. Another interesting question, are probiotic preparations, example, lactobacillus tablets, an effective treatment for bacterial vaginosis? Lactobacillus oral tablets, suppositories, and intravaginal preparations are sold in some health food shops for the treatment of bacterial vaginosis. These have been found to be beneficial in some cases. However, results of studies are mixed, and overall, specialists feel that there is not enough evidence in favor of these treatments over other treatments. Our next question is a very interesting one. Should my partner be treated for bacterial vaginosis? There is no evidence that treating a male sexual partner prevents his female sexual partner from developing bacterial vaginosis. One small trial looked at whether using a sterilizing alcohol gel on the penis protected their partners against bacterial vaginosis, but the gel appeared to make bacterial vaginosis more rather than less common in women. If you have a female partner, then it does not appear that treating her for bacterial vaginosis at the same time as you, even if she doesn't have symptoms, will prevent recurrence in either of you. Another interesting question, what is the treatment for persistent bacterial vaginosis? If you have persistent bacterial vaginosis, that is, it does not settle down with the first treatment, then your doctor may request further vaginal swabs to check whether there is another cause of the discharge. Another treatment which may be tried is metronidazole gel twice a week for up to 6 months. If you have persistent bacterial vaginosis infection, which does not respond to treatment, and you have an intrauterine contraceptive device, then your doctor may advise removing the device until things settle down, as there is some evidence that intrauterine devices can contribute to persistent bacterial vaginosis. And our last but not the least question, will I get bacterial vaginosis again? Bacterial vaginosis often recurs, usually within a few months of treatment. If you carry out the preventive measures, then it may be less likely to recur. I hope you have learned something today. Please give this video a thumbs up, share with family and friends, and leave your comments and your questions in the comment section. If you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell, so you will be amongst the first to see any video that I upload. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.